what's not working in our healthcare system?
A number of things. I could take that question anywhere, quite frankly. But I want to just talk about this on a very personal level for 1 second. People feel pushed through the healthcare system. And I know that I have a friend, she died, she was in an HMO, couldn't get access to the referral that she needed right away. So it's a little, maybe not, I mean, who knows at the end of the day. I mean, you hear these stories. I've met a few people that during the course of my research for my book lost their homes and their jobs. So, there's a lot of things not working in healthcare today. And really where we are, we're on the verge of a perfect storm. We have an increase in healthcare costs today that's unsustainable. We have rise, we're in a recession, if I can say that. We're creating debt, long-term debt from the war that we're in, right, wrong, or indifferent. And we have variable outcomes. So when you look at cost and value, there's a question mark there. And then we're in the middle of a political cycle. So the time is ripe for change, but hope is not a strategy. What we need is a real plan, and what a real plan would look like is something moderate, something in the middle. Left is not left and right is not right. What we need to do is get a baby step that everybody could agree on, and that would be the separation of health insurance and employment as a first step.
Okay. Now, there are some significant things actually happening in healthcare right now,
Mm-hmm.
and you know what they are.
Well, it's the cost. It's all, Bill Clinton's thing about it was about the economy stupid. Well, I'm telling you, in healthcare, it's about the cost. And I won't call you stupid. But it's all about the cost. In 2006, we spent $2 trillion. In 2017, we're going to spend $4 trillion. That'll be about roughly 20% of our GDP. That is unsustainable. So this is like a tsunami coming over our shores, and we need to have a plan on how to deal with it. And when we deal with it, America was built on free choice, and the free choice makes us a very innovative country that people want to immigrate to. I mean, this is what makes America great. So we need to keep the choice, and the way to do that is maintaining individual freedoms by separating health insurance and employment. I'm going to keep coming back to that because that's the most important thing that we need to do right now, to keep choice.
Wow, okay. And what else do we need to know about cost and choices? What else can help us on this front?
Yeah, cost and choices. I mean, again, think about this. We have lots and lots of costs and very little choices. So we need to change that dynamic. America loves choices, and when we get everybody into the risk pool, here's the strategy. You get everybody into the risk pool together, you can reduce the cost because you're spreading the risk. This is how insurance works. So just like homeowners and auto insurance, everybody can obtain it. Now, there's difference in pricing depending on your circumstances, and that's fair. This is the way free markets work, or semi-free markets, which is what healthcare is. It's semi-free. So this is good. So we need to change a few legislations and tax structures, but it's doable, and it's doable right now, and it's imperative that we do it.
And I know you talk about certain inequality issues in this area. What do you mean by that?
Right. Well, when you think about inequality in healthcare, it stems from health insurance, because that's the first thing everybody wants to know. You try to make an appointment or you go in to see anybody, they want to know, do you have health insurance? So how do you get your health insurance today? So today you either get it from an employer or you buy it yourself, and or you get it from the government, but in that case, that's a little bit out of this discussion, because government people who are getting their insurance from the government will continue to do that. But for the pool that's not government insured, people who are getting it through a large employer are getting a tax benefit that people in small businesses and individual policyholders do not get. So there's a little inequality right there. Further, when you go to use the health insurance, if you have health insurance, then you get certain choices and freedoms, and if you don't get those. And that's a big driver, because just as wealth is dividing America, so is access to health care. So this is imperative. I mean, we're a land that wants to be inclusive, and the time is now to separate health insurance and employment. And I talk all about it in my book.
What's the name of the book?
Personalizingyourhealthcare.com. Blog is the same thing. Lots of consumer-oriented information, free information, tips. You can do your research there. www.personalizingyourhealthcare.com.
I thank you for being here.
Thank you very much for having me.